welcome you all and Life for Motherhood, Session 1 of TendingTech, a series that aims to shed light on the journey of entrepreneurs. The healthcare industry, also called the medical industry or health economy, is an aggregation and integration of sectors within the economy and economic system that offers solutions to treat patients with curative, preventive, rehabilitative, and palliative care. Going into the future, it appears that entrepreneurship and healthcare are linked and will always continue to be so. Savemom provides connected maternal care at home using local communities, smart devices, and telemedicine software, which allows for women to get better access to quality and personalized maternal care during pregnancy. Savemom has successfully deployed its solutions to support more than 36,000 pregnant women in partnerships with state governments across 4 states in India. These efforts have led to a significant increase of about 40% in postnatal health. I now hand over the session to our student executives, Ms. Twinkle and Mr. Raghavendra.
Good afternoon, everyone. I'm Twinkle Chitalia.
Yeah. So good afternoon, everyone. I am Raghavendra. So it gives me immense pleasure to introduce today's healthcare entrepreneur, Mr. Senthilkumar Murugesan, co-founder at Savemom Private Limited, India, as part of TendingTech series jointly conducted by Department of Management Studies, DSCE, IEDC DSCE, and DERBI Foundation in association with Social Innovation in Healthcare Initiative, TDR, the special program for research on diseases of poverty and Sida. Senthilkumar Murugesan is a mentor who sees more talent and ability within someone and helps bring it out. He has a great passion for innovating through technology to solve real life problems in many fields like network, defense, maternal healthcare, etc. He began as an engineer and is now called an entrepreneur, speaker, and mentor. His active engagement with community empowerment and education initiatives, especially among girls and young women through Metoo Mentor, a non-profit organization that mentors young women to innovate through technology, is awe-inspiring. He has offered guest lecturers in more than 80 higher education institutes in India and has been honored as one of the top 5 technology explorers in India by Nasscom. He has won several hackathons at the national and international level and represented India in Battlemesh Research Programme in Europe. Welcome, Mr. Senthil.
Thank you.
Yeah. So, Senthil, can you walk us through the journey of Savemom, please?
So, good afternoon, everyone. First of all, thanks to the DERBI and Dayananda Sagar management for this opportunity. I'm one of the incubated startup of DERBI. So, company name is called Savemom. And thanks for Twinkle and Raghavendra for the introduction. So, as I told, today's session, I have split into two things. Initially, I'll talk about the story behind Savemom and how it started and what are the challenges we face and how with the help of technology we deployed it. And second part of the session, I would like to interact with you with various Q&As, and I want you people to be able to identify your own community problems, so how we can solve those problems. So that's the main objective of this session. I'm sharing my presentation. Yeah. So the deck is visible to all.
Yes, Senthil, you can go ahead.
So myself, I'm an engineer. I worked in company like Samsung and Qualcomm. I completed my electronics and communication in 2010. Then joined Samsung, where I worked mostly on the Galaxy phone series. And in Qualcomm, I worked mostly on the 4G and 5G systems. So one fine day, I got a call from my mom saying that my sister was pregnant. I was so excited to hear that. But my mom told that she's not going for her antenatal checkup. So as a brother, please advise her so that she will take it serious and then go for the regular checkup. So myself, I really don't know what is that antenatal checkup mean. So I went to the internet, I searched about that. I come to know that as per the World Health Organization, every woman has to go through minimum 8 antenatal checkup. It is basically a monthly hospital visit to identify any high risk pattern at very early stage. Missing those antenatal checkup leads to have a complicated at the time of delivery. And because of that, there is a possibility of either maternal death or a neonatal death. And country like India, which has the highest number of maternal death in the world. So I understand the seriousness. So I went to her and asked, these checkups are very important, but why you are not doing it? She responded me saying that if I go to the hospital, there's a traveling time, which is like 5 to 10 kilometers. And if I book an appointment or not, they make me to wait for minimum 5 to 6 hours in the hospital just to get a 5-minute consulting from the doctor. So I directly went to the hospital and interacted with the doctor. So I asked the doctor, like, every time my sister comes here, what exactly you do in the hospital and why it takes so much of time. So the doctor told, basically, these are the device. Using this device, we capture her vitals, which is like blood pressure, blood sugar, heart rate, saturation, temperature, weight. So all this data we will capture. On average, it takes 10 to 15 minutes per patient. After capturing this data, the nurse will, they will be in the token. There's a token number will be given to them. Based on the token, every mother will be invited to the consulting. There is a consulting token. So let us assume that means 10 minutes mean like in an hour, you can give maximum 5 to 6 patients for the complete checkup. So here I asked the doctor, instead of this physical visit, if I bring all this vital digitally to you, will that make sense for you to take a decision? So the doctor responded, yes, yeah, that we can do, because the nurse end of the day write everything in the paper pen and then showing those record and giving a suggestion. If it is a digital form, still I could be able to make a decision. So from there, I realized, like, I'm an engineer. So what I did is I went to the pharmacy and bought all this medical device. I saw that this device has a display. So if I'm using this blood pressure monitor, I can see what is my blood pressure. But problem is I'm not a health professional. So immediately I will go and search internet. What is this? My blood pressure shows 130, 140. And we all know how internet works. If you search internet that you have a shoulder pain, the first result will show it is a symptom of heart attack. After seeing the result, you will get anxiety and panic. Okay. Most of the stuff in the internet throws a negative. So what I have done is, as an engineer, I removed a display in all this device and put a small Bluetooth chip inside and build a basic application for her. This is a very basic application I built for my sister, and I informed her, whenever you feel some uncomfortable, you want to talk to the doctor, you need to visit the hospital. Okay, you just to take all the device, click one button in the application. This application will capture all your parameters seamlessly. Once that is captured, the data will be directly sent to the doctor as an SMS. So I inform the doctor, whenever my sister do a checkup, you will get one SMS link. You just click that. The same form, how the nurse will show the yellow color page, the same form it will show her data and vitals. If you find everything is normal, you can say good. So I'll send nice smiley to my sister saying that you are good, safe, you don't need to get panic. If you find any abnormality, you can press this bad button. Here, what I will do is I will directly inform her husband, hey, there is some emergency, like, she need to visit in the hospital. And meantime, I will book a token number in the hospital system so that automatically the token is counted. And if a husband is not able to come, there's an option I gave where they can directly book a cab. It's automatically book a cab where the source address is my sister's home and the destination address is the hospital. So this Ola cab will be booked through the web, and it go to her home, pick her, and drop into the hospital. The token number also will match, and so you don't need to wait in any queue to collect the vitals because already vitals are in digital form. So if you can directly jump into the consulting room, have a quick consulting with the doctor, and based on that, either if a normal, they can give a prescription, or any lab test is okay, they can do that. So I built a simple product and gave it to her, and she started using throughout her pregnancy. She delivered with a baby girl, and she told me that her entire pregnancy experience was really joyful because she felt my doctor is always connected. If something goes bad in my health, my husband is already informed. That psychological thing made her have a very positive experience. She starts searching internet, start using this application. So after this, like, a lot of my friends, her friends, like, they started asking me, can we get this solution? Because I also want to monitor my wife or sister. So I find some demand where people are asking. Then I thought, okay, this might be a right problem to solve. But initial days, I don't want to directly jump into the urban market. So I thought of I'll quit my job and take this as my full time and do more effort field study. And because India is the highest in the world, almost 800 mothers dies in a worldwide. This is one of the big problem. Every 2 minutes a woman dies because of the complication in the child. Even European countries and all, if you see, they don't want to have a baby. That's why the entire birth rate is going down. I even felt like, I don't want a woman to die because they are delivering a baby. So every woman has to be, personalized to give a premium experience during this time. So I went to a lot of tribal villages, which is in Ooty, Wayanad tribal belt. It's all moving tribal community. So one village I went and started interacting with a woman there. One woman told this is their second pregnancy. At first pregnancy, the baby was about at 7th month, the baby was no. So I'm curious to know what is the reason, what happened to the baby, what happened to the mother. So I went to the primary healthcare center and I asked them to give this MCP card. It's called Mother and Child Protection Card, to know the reason what happened to the baby. So they show the card, but the card says the baby born successfully and it has the age of 2, and they have taken 10,000 rupees, some 6 to 10,000 rupees money from the government, and the baby's vaccination, everything is done. So I took a copy of this and go back to their home. Till the time the husband never talked to me. After seeing that there is a money transfer, all the signature and all, he told me that the primary healthcare center is almost 20 kilometers away from the home. So most of the time I never take her to the hospital, but we were surprised that government is giving some incentive, financial support, and we were surprised that they are saying baby born. So I wondered what might be the real story here. So I directly went to the district health department and I told them that the entire taluk, how many of them pregnant, how many of them delivered baby, and if any abnormality, I want the complete record. So there is one person in the rural hospital. She opened up an Excel sheet. She has a basic ready-made template with all the woman name. She's filling all their vitals, checkup details in front of me with some template, and she's take a printout and gave it to me. And I asked her, this is how you generate health reports. Very innocently, she told, yes, sir, my boss told, any person from government, WHO, World Health Organization, or NGO, come and ask for a health report. This is the predefined format you have to do. So here I realized that what happening is government has a beautiful schemes for this to reduce this unnecessary death, but the schemes are not reaching the end user. So the health worker, what happening is they are manipulating information in the system. So for the district officer or in a government, for them, end of the day, it's a report. The report says 300 mother, all of them get all the support, financial one. They are very healthy. Government really don't know, really they're getting or not. So what I thought is, whatever I built for my sister, which is bringing the healthcare to their home, can I do the similar model? So I have built a combination of device. First one is the wearable one. So the wearable looks like a gold color bracelet. I just gave it to the pregnant mother. So what it will do is it will monitor her activity and reminds when to take medicine, when is the next checkup, when is the delivery time, and it can hold their entire medical history because they may not carry the paper pen report. Sometimes they miss it. So the digital form of their health report will be stored on this gold color bracelet. And I build a medical device, give it to this ASHA worker. So the ASHA worker, the model is every month, the mother who are not visiting the PHC, the ASHA worker will go to their home and collect their symptoms. With this device, they capture all the vital parameters. The data will be sent to the doctor. The doctor has a portal where they can go through the data and they can identify high risk, low risk mother. If a mother is in low risk, the health worker will again go to their home, distribute iron, folic acid tablet and nutrition kit. For a mother who are in a high risk, they take them to the nearest hospital to do their blood test, ultrasound, all those things. And that report again uploaded into the platform. For the district officer, they can open the portal and see complete report of every mother, their health condition, what happening on their health, high risk mother have follow-up on it. So like a portal I built and deployed into this region. So the project is going good. So I'm myself also like monitoring all the data. Is the data is accurate, decision making is happening. So this is how they do every month. Go to their home, do a checkup, and digitally the data will be transferred to the doctor. So this is a wearable. I told it's a bracelet kind of a wearable. I gave to them. So one fine day, we are observing a data. The data looks really weird. It says almost 80,000 steps your mother is doing every day, and the algorithm is alerting that she is over stressing her body. So we are wondering why she is like jogging every day. She's putting stress on her body. So I don't know, maybe the family member putting a lot of work for her. So we go to their home and educate that because she's almost 8th month. We don't want any risk from that. So we went to her home and we found that she's not even having the wearable in her wrist. So I thought might be she lost the device. So I asked her, did you lost the device where it? And she told, no, sir, I didn't lost the device. My husband told, I'm going outside, so give that watch to me. So he took the wearable from her. So whatever data we collected is actually husband data, which does not have any fetal information. And our algorithm got a lot of confusion and it has a lot of highlighting. Now my big challenge is how to convince the husband, please give the device for next 9 months and later you can take the device. That's not a problem. So there's another mother, again, we went to her home and we asked her, your husband also take the device because you are not wearing it. And she told, no, sir, the device looks luxury. If I wear it and go outside, I'm the only person in the community wearing something in the gold color. So everyone in my community seeing my wrist. So I felt annoying. So what I will do is I only wear the device inside the home. If I'm going outside, I don't wear the device. So now the problem is not only the husband, it's more on cultural problem. Because even if I give an Apple Watch to them, they may not wear it. Either someone will take it. So I don't know how to solve this problem. So every woman in these are tribal people, they have something called Usi Mani Pass, this kind of a small beads they have. So I asked them what you people are wearing in the wrist. So they told this is our traditional wear. Like every woman in the community they have this. So immediately asked them, if I give anything in that form factor, will you wear it for 9-month period? And she laughed and told me that, sir, if you are giving in this form factor, I can guarantee that my husband never take it from me. Because this is a woman thing, he don't want to wear that. So I'm confidently saying that my husband never take it from me. Then I come back again, restarted the innovation in the wearable. We have built this product. This is the one, I show it in the screen also. Yeah, this is the product. So the center bead you see, that is the sensor. The remaining is a strap. The idea is whatever form factor they want to change, they can change it. The center is the sensor. One is the mother delivered the baby. See, they can, this is for the baby. The center bead, they'll change it and put it on the small strap and give it to the baby and it start monitoring the baby for next period. So another thing is it has 6 months of battery life and powered by a small coin cell battery. The good thing is they don't need to recharge because even Apple Watch, they need to recharge at least alternating ways. So I give this one. Even some woman has something in their neck. So what I told them is you just remove the sensor attached to your neck wearable, that become a smart wearable. So some alternation I have done and then I gave it to them. They started using this one. Now the next challenge is, so initially we have a bunch of devices. The devices kept it in the bag. So if you see ECG machine is very big, and blood pressure monitor, all these big medical devices, we kept it in the bag and asked the health worker to walk all this 10-20 kilometers to reach the home. So one fine day, what I have done is like we see that the number of visits they are doing every day is actually less. They are not even completing 6 to 10, maximum 6 is they are completing. They can go for 10 women every day. So one fine day, I carried the bag and walked along with them in the mountain trails. And I found that the bag is very heavy because of the ECG machine, all these big medical devices. So I told the health worker, instead of this big thing, if I give something in a small form factor, where you can put it on your mobile pouch. Will that helpful to you? So the lady immediately responded, so if it is in a small form factor, I can even visit 15 mother in a day. Because of this is heavy, I'm not able to uphill the mountain. So what I have done is I built a next product. You can see it here. Yeah, this is the product. You can see it. So ECG machine is the big, right? Like, what I put is I put those ECG patches, 3 patches in the device. Now the model is very simple. You gave this device to the pregnant mother, ask them to put it on their forehead like this. Okay, and it has a various sensor, blood pressure sensor, ECG sensor, all the sensor. Hold it on forehead like few seconds. And what it will do is it will capture more than 6 vital parameter digitally and directly send this data to the doctor. Directly send this data to the doctor for further feedback and screening. Here, another helpful thing is the health worker not need to enter any medical device, because whenever they enter the blood pressure, they sometimes say 20/80 instead of 120/80. They can give wrong number. But now it's happening digitally. We could able to avoid a lot of manual human error with this innovative product. And good thing is it can be kept inside the mobile pouch, and even pregnant mother felt like this very comfortable. They don't get scared. Initially ECG and all, it's a complicated process. We need to ask them to remove the dress, put the patches on the tribal community. They don't support this, but this one they enjoyed it. They just keep it, we capture all the data, digitally transfer to them. So the checkup time also reduced. With 30 seconds, we could able to complete the entire health screening and go for another. So this is another innovation we have done. And after doing all those things, we could able to get proper data. And our the next problem is, now I solved the problem of pregnant mother. Second is the health worker. The next problem is doctor. Till the time the doctor never seen more than 20 to 30 women in a month. Okay, so what happened is like this is the first time they are getting more than 150 pregnant mother data. Now the doctor has to respond to all the mothers. Doctor told me that this is overwhelming because I can't see all the data at a time and give a feedback. So if a doctor is not giving the feedback at right time, the entire circle will be affected. Because day 1 they are doing the checkup, day 2 doctor feedback, day 3 again they're going to the field. This is for one pregnant mother. This is happening in the month. If doctor not giving the feedback at right time, then the cycle will affected. So what I did is like I asked the doctor, please help me. Like what I'll do is I'll build an AI doctor. I'll put basic AI algorithm here. What this algorithm will do is all this 120 mother, it will classify them into the high risk and low risk bucket. So in your portal, first page, I will only show the high risk mother. You can immediately give the feedback to them. Later, whenever you get a time, you can give a feedback for the low risk mother. Doctor told if anything less than 20 or 30, I'm happy to do it. Okay, because that is my count. So with the doctor help, we built this basic AI model and put it on our system. So what the system will do is the system, this is the AI. So now wearable will capture the activity vital parameter. This medical device capture the vitals. The data through the health worker application will be sent to the AI system. The AI system will classify them into high risk, low risk bucket. And this is the doctor portal. Doctor can quickly give a feedback. Again, the feedback populated to the feedback is populated to this mobile application of the health worker. Based on that, the action is taken. So after all the program is implemented, we able to identify the real high risk mother, and most of the high risk mothers are actually the malnutrition one. And we told them that the district officer, so we able to identify malnutrition pregnant mother. We able to identify the malnutrition pregnant mother. So we need to provide a proper health checkup for them. We need to identify the proper health kit to this mother. So with their help, we got this nutrition pack and we start distributing this nutrition kit. So after giving this nutrition kit, still there is no improvement in the health because still their weight is continuously decreasing. So as a pregnant mother, the weight has to continuously increase, but the weight is continuously decreasing. 1 second, please. 1 second. Sorry, guys. So, as per the model, the weight has to increase every month checkup, but for them, it is going down. First month, they will be like 52 kg, and then it go down 50, 47, like that, it decreases. So, we provided enough nutrition, but still there's no improvement. So, again, we went to their home to see like what they are doing with this nutrition kit. We observed that whatever kit we are providing to this family member, they are giving to their family, whether husband or children. She is not taking any of this nutrition. So it's a typical Indian problem, like in a where woman will give everything to the family member, and we found one pattern that she has drinking a lot of water. I don't know, like because she's giving everything to the family, so the water she's continuously consuming. So we thought of a hack. So what I have recommended the health worker is we will split the nutrition into the two components. One is the normal nutrition, another one is the powder nutrition. So the powder nutrition, we will, I'll ask the health worker, after your checkup is over, you open the hot water, mix the powder inside, and then add some kind of a neem inside so that the family member never touches that water. So let's see what happened. Like a small hack we have done. So after a 1 month interval, I received a call from a doctor that most of these anemic cases are went down, and all of the mothers' weight went for 1 kg improvement. And doctor asked, what you guys did, like suddenly there is a change. Then I have told that, sir, we have done some hack. We put the nutrition on the water. So now they themselves, without knowing that they're drinking a highly nutritionized water, so that has the improvement. So this project will keep on going there, and 1 year is almost completed, the first iteration. So there's a newborn baby in the village. So there's a baby born there. So the village head, he called me and he told, you should come and see the baby. So I went to the village. All the people, almost 120 plus people gathered in the village. Everyone is holding this newborn baby from one hand to other hand. So like that, they're holding one hand to other hand. I was wondering what they're doing with the newborn baby. And this pregnant mother's mom, she just gave the baby to my hand, and she told me that this is the first time in our village we could able to feel the weight of the baby, and baby is smiling. We never ever seen a smiling baby after the birth. So everyone in the village was so excited, and they want to see such a smiling, healthy baby. So they're all gathered and they're literally celebrating this, tribal people. And she told, we're very thankful like that. Even as an engineer, I worked in the industry for almost 6 years. I built all 5G, 4G technology, but all my output will be in a digital form, which I never able to touch it. It's inside my computer. But this is the first time I felt like my output in the physical form smiling in front of me. So I felt like very simple tool and technology. What we enabled is their checkup is happening, their nutrition is transparently delivered, and there's a proper consumption, some hack on that. But the impact is huge. Literally the entire community is celebrating it. So typically the baby in the village, even there is a class comparison. The baby in village, mostly malnutrition, the average weight is 2.2 kg. This baby has 2.9 kg weight because of our hacked nutrition program, and then our technology enabled antenatal visit. So after this project, we deployed in all the tribal community, wherever even a government could not be able to reach. This is a migrating community. They move from one place to other place. So I even pointed out all those regions in the map and went to every village in the entire Western Ghat mountain region, starting from Kerala to Maharashtra. All the places we deployed this project, and we monitored almost 36,000 tribal mother, and we make sure that all the mother get same experience of what my sister got, with a premium high quality pregnancy care. And some of the mother told me that in our village, even none of my sister, elder sister, my mom, they never get. I felt premium because someone is knocking my door every month and giving a premium care. They are doing checkup. They care about me. There's a system. Someone is calling and updating. I never get such experience. None of our people in the community get this kind of experience. Because of that, psychologically, I felt I'm healthy. People are there to take care of me. So that leads to have this positive pregnancy. Another mother told, they asked me to wait 6 to 8 hours. I go to the hospital at 8 a.m. and then come back to my village at 6 p.m. I may not even have a food. That's how I used to do checkup. But within 10 to 15 minutes, in my home, checks are done, nutrition provided, tablet, pharmacy, everything is done on my home. So I felt real premium. So as a technology, what we have done is when we proposed this to a lot of state government, what we guarantee you that whatever schemes you are deploying, I ensure that the schemes are reaching the end user and they are properly monitored. Importantly, the deliveries are happening in the hospital. Okay, and complete reduction of maternal death and neonatal death in those tribal community. This project was a huge success that leads to get the award from a Nobel Prize team. In 2016, they have invited me to Mexico to give this award called Gifted Citizen of 2019. We have received a lot of government recognition. Sundar Pichai is part of this Google for India conference. So they have featured our innovation in the conference. I can even show that it is called Senthil Inspires India. If you watch out that, it will be there. I show a couple of videos to guys to understand, see the real village, how the village is like, how the entire journey happened. Because I told the story, but when you see it in visual, the impact will be different. So this is the video taken by the Google.
Sorry to interrupt, Senthil. Are you playing the video at your end? Because we are not able to see the video actually.
Oh, you're not able to see the video?
Yeah.
Oh,
you might have to just share the video window directly instead of the PPT.
Yeah. Yeah. Now it's visible.
जो अपने शहर के लिए एक सेफ्टी ऐप पे
It's visible and audible, right?
Yes, Senthil.
काम कर रहे हैं। इनकी इंस्पिरेशन
मेंटर सेंथिल सर,
सेंथिल कुमार, एंटरप्रेन्योर, टीचर, पर सबसे पहले एक कोडर जिन्होंने गर्भवती महिलाओं के लिए एक हेल्थ ऐप बनाया है।
In the village, it is impossible for pregnant women to go to the hospital, which is 20 kilometers away. I used code to make certain devices and apps that bring the hospital to them in this crucial time.
दरअसल ये कहानी टेक्नोलॉजी की नहीं है, ना ही इंटरनेट की। ये कहानी है सेंथिल की, ऋतिक की, रियाज की, पद्मावती की और हर उस इंडियन की जो किसी नए तरीके, किसी नई तरकीब से अपनी और दूसरों की जिंदगी बदल रहे हैं और जाने अनजाने में एक दूसरे को भी इंस्पायर कर रहे हैं, हमें इंस्पायर कर रहे हैं।
And another video, the impact video, which those tribal community we have. This is the actually in the video you see some school. The reason is when I went to this tribal community, initially none of the people is ready to interact with me. Like they find it someone outside. No one is opening. When I'm asking them, no one even talking that. So the first few days was like that. No one. I'm trying to interact with them. No one is interacting. So I found one school where the kids are there, but no teacher. So what I have done is the next 2 days I went to the school. I start teaching them some science, technology, something. So what I start influencing these kids about what I'm trying to do in this village. And these kids went back to their home talking about me, like what I have explaining to them. Because of that, especially that the community leader, he was allowed me to interact with the pregnant mother. Then I come to know the problem and started with them. So the journey started from this small classroom.
understand the maternal care scenario in the remote regions, we visited Vellaram Kunnu, a tribal village under Amrita Sir, which stands on the southern tip of the Deccan Plateau, a part of the Western Ghats around 3,000 feet above the sea level. The village is surrounded by rich flora and fauna and is a home for 75 families. Access to healthcare is 2 hours away from Vellaram Kunnu. Currently, there are 7 pregnant women in this village. With the help of Mr. Hari, who is the social worker at the Amrita Sir, we had an opportunity to interact with them and understand the journey of their pregnancy. Jyoti is 19 years old and she is pregnant with her second child. She lost her first baby to stillbirth during 7 months of pregnancy.
അപ്പോൾ ഒരു മാസം പുറത്ത് മാറാണ്ടിരുന്നപ്പോൾ ഡോക്ടറെ പോയി കണ്ടു. അങ്ങനെയായിരുന്നു. ടീച്ചർ അംഗൻവാടി ടീച്ചറെ കണ്ടു. ഓക്കെ. ആശുപത്രിയിൽ പോയി പ്രസവം ഉണ്ടായി 7ാം മാസത്തിലാണ്. അപ്പം കുട്ടിക്ക് ഉണ്ടായിരുന്നില്ല.
This is the girl I interacted initially. Like she only told that first baby is no more. This is her second baby. The thing is, her age is 17 or 18. They are like no married very early.
പക്ഷെ കുട്ടിക്ക് ജീവൻ ഉണ്ടായിരുന്നു.
Out of 7 pregnant women, 2 had lost their babies during pregnancy, 6 were under 16 during their first pregnancy, none had more than 2 antenatal sessions. With a low doctor to pregnant women ratio and poor accessibility to maternal health care for rural women, how do we envisage better maternal care in India? Introducing Savemom, an IoT-based maternal healthcare solution that promises to effectively address the malady of poor maternal healthcare in the remote regions of India. Our solution involves 3 major steps: identifying pregnant women in the remote region, conducting periodic antenatal diagnosis and provide timely professional assistance through telemedicine, empower healthcare worker and pregnant women on maternal care. Our healthcare worker would be measuring the vitals of pregnant women bi-weekly once and send the data via cloud. The data is examined by a remote medical officer for reviews and feedbacks. Our healthcare worker would then act upon the feedbacks, networking with local healthcare professionals. Our model aims to provide more than 16 antenatal care sessions. We believe that no woman should die giving birth.
As a company, like now for the past 5 years, we full-fledged focusing on this particular problem statement. We mainly working with the state government. In Tamil Nadu, we are reaching almost 50 lakh women through this program. So all the women, we are taking it beyond pregnancy. We are focusing more on women health. And in pregnancy, our target is 1,000-day care. So not only after delivering, we start monitoring the baby, the vaccination, everything. Our objective is no woman dies by giving a birth. In that main goal, we are operating. And so we realized that simple tools, the impact on the field is really tremendous. As an engineer, I felt when I hold the baby. Yeah, thank you so much for this. I'm open for any question, Q&A session.
Sir, how did this pan out during the pandemic?
Yes, it's a very good question because during the pandemic, our challenges, we could not able to travel to the village. That time we are closely working with this district collector in our region. That time, like now, what happening is there are a lot of COVID patients is coming. COVID patients are there. Most of them who are in mild COVID cases, they have enough money. What these guys will do is they'll go and get their beds. They will pre-book the bed in the hospital. Because of that, the people who are in a high risk, they could not able to get the bed. So with the same technology and tools, we started monitoring all the mild patient, the mild COVID patient. So we could able to deploy them in the COVID care center, use wearable, our medical device. In a 14-day quarantine period, we continuously monitor them. There is a video consulting platform. With this, actually, we monitor almost 1,06,000 COVID positive patient in 12 districts in Tamil Nadu. So COVID time also technology, but changed to the COVID care, but still it worked and created that impact.
So, Sendil, drawing upon what was said earlier, that technology and healthcare will be connected even in the future. So, how would you motivate the youth of today to enter this field in entrepreneurship?
Before entrepreneurship, I want to tell like all these college students, see, you have a beautiful time. This 4 year, 5 year period is a really valuable time because you realize this when you get out of a college and you're never able to get that freedom of thinking and doing stuff in your corporate. So this is a right time where you can become a maker. Before even one step before entrepreneurship, you should be a maker. You should be a problem solver. Identify problem in your own community. You may not be a technologist to solve the problem, but understanding the problem very well, your customer itself will give a solution. In my case, I feel like the woman who gave that, if you give the wearable in this wheat farm, all the people in the community will this. The answer is coming from them. The health worker gave me that instead of a bag, if you give it in a small farm, so your customer give the solution for you. So your role is understand the problem, get the solution from your customer, and there are tons of technology tools are available. You just need to connect these dots. So before even starting your entrepreneurship journey, if you take Mark Zuckerberg, anyone, we all know that they have a dropped from college, they start a big company, but understand before that they are all become a maker. They solve small problem and they could able to sell the problem in a meaningful way. So that is what I request you all to do in your college days. Solve small problem and build like a product out of it and try to sell it. Okay, might be you can sell it for free, no problem, because Mark Zuckerberg sold the entire music search library to Microsoft for free. Once that success story happened in your college days, entrepreneurship is all about raising proper capital and building a bigger team and executive and scale your product. That is where entrepreneurship lies, and that needs a lot of capital. A lot of capital will come when you demonstrated so many small success stories in your college days. So I request you identify your own community problem and use technology to fix it. Then you start your entrepreneurship based on that success story.
Sir, what legacy would you like to leave behind in the world?
That's a term I told. I don't want any woman to die by giving birth. This is what I keep on tell every day. Because country like Europe, the big challenge is no one want to have a baby because they are feeling like in the time of pregnancy, it's a health risk. The second one is they are feeling like, my peers, like a men and women, okay, I am having a delivery and baby care for 2 years. In that 2 year time, my peer is going like a VP of the company. He is moving fast. So a lot of women in European countries thinking that why I need to go for the complicated, so I'm not going to have a baby. So if all the women in the country decided that we are not going to have a baby in next 50 to 60 years, the total population in the world becomes zero. So I took my decision that I want to ensure no woman dies by giving a birth, and their pregnancy should be the most joyful, enjoyable experience. I want to do that in my life.
So let's now open the session to the audience for question and answers. So audience, if you have any question, you can post it to Sendil.
Audience, if you have any questions, we have enabled you to unmute yourself as well. Please feel free to unmute and ask as well.
Hi, Mr. Senthil. It was very inspiring, very inspiring story. I would like to know how long it takes you to make that final product from the beginning as once you go decided to the current product. How long it takes?
2015 it starts and it gets stabilized and commercial, like proper commercial form. It happened on 2018. So almost a 3-year time frame because it went on multiple iteration. So the final whatever product right now we are using, it took 3-year time frame, and which has the clinical trials, certification, medical clearance, those things, everything is included in that 3-year.
Yes, sir. Okay. Then who will be your pay? How you get the money? Who is your actual buying customer who is paying you?
Yeah, see, our customers are pregnant mother directly because I told, right, if it's urban or rural, the mother is getting some financial support from the government. So we charge our basic pay start from 1,000 rupees for the care, for the entire year care. So we directly charge that pregnant mother.
Thank you.
So I have a question to ask.
Yeah, yes.
Go ahead, Aditi.
Good afternoon, sir.
Good afternoon. Yeah, you are
Good
audible.
afternoon, sir.
Yeah, good afternoon.
So my question is, have you ever faced any situation where a patient was not ready to share their crucial information? And how did you try handling that situation?
I told, right, even initially they're not even ready to wear the device. So the next stage, like, so there are a lot of challenges. That's why it's all about, I find it, if you are part of the community, they ready to, the trust should be created. So once the trust is created in the community, then they have to believe that you are here to help them. So I spend a lot of time and effort to create the trust in the community. Once that success story is there, and demonstrating the success story everywhere and replicating the model was very easy. Okay, when they realize that you are here not to harm them, to really help them, then they don't hesitate to share all this information.
Okay. Thank you, sir.
Senthil, drawing upon what was said earlier, so like you told that youth, you would be able to like motivating youth to enter into this entrepreneurship. So what kind of technologies they are about to do so? So any kind of brief idea, could you please give it for the youth?
Yeah. See,
like said,
in
few
terms,
of the idea like small products we are about to create and sell it for free.
See, before even jumping to the technology, I want all of them try to understand this design thinking process. So design thinking process is well-defined framework where it allow you to interact with the customer, because in India, the problem is we are all technologists, but we really don't know how to use the tools and where to use the tools. The problem is we learn technology, we know how to write a Java program, we know how to write like a web application, we know all those tools. That means we know how to manufacture a small brick, but none of them teach us how to build a small house with that brick. That is the problem. So I request you, like during this time, go for a design thinking approach. Try to understand the blueprint of building a house. That's the first step. Then if you're using a brick or if you're using any other material to build a house, that does not matter at all. Okay. So whatever, because even you don't need a complicated technology to solve this kind of a problem. So basic technology is more than enough. And another good thing is there are tons of open source tools are available. You just need to take it up and plug it together to solve the problem. That's what I recommended. More focus on design thinking process. Technology is already available. You just need to attach it.
Yeah. So thank you, Senthil. I hope you have resolved all the queries among the audience as well as me and Twinkle's questions. So now I'd like to ask Twinkle to give vote of thanks for this last agenda of this session. Yeah, Twinkle, please.
Mr. Senthil, it was an honor to share the platform with you today. Thank you for taking your time and sharing your experience with us. On behalf of the Department of Management Studies, Dayananda Sagar College of Engineering, we thank the management of DSCE and the principal, Dr. CPS Prakash, Dr. Lakshmi Jagannathan, CEO at DERBI Foundation, and the team at DERBI Foundation for their guidance and motivation. Our beloved HOD, Dr. KG Hemalata, for giving us this opportunity, and our faculty members for their constant support. We once again thank you all for joining us today. We shall come back soon with another journey of another entrepreneur. Stay tuned.
Thank you so much for the opportunity. I have shared my website and contact email, and anyone want to connect with us, feel free to reach out. Any problem you want to solve, feel free to reach out. You guys are management guys. You have more scope because in India a lot of engineers are there, but no engineers know which problem to solve, and you guys can build a market for them. Yeah. Thanks so much.
Thank you, sir.
So much, Senthil.
Thanks.